We are delighted to have you. I am going to, for those of you who don't know me, I'm Mary Dwight. I oversee the Foundation's Policy and Compass programs. I am joined by my colleague, Ozzie Cater, from the Compass program, and also Kat Porco, a mom of a child with CF, and Lori Yoder, a social worker from Northwestern Hospital. So we are going to go ahead and dive right in. Let's see, I'm going to drive. That's me. We are going to be taking questions at the end of the session. I'm going to set my donut hole down until I'm done talking. Then I'll be eating my donut hole while you guys talk. We'll be taking questions just as we've been doing throughout the conference. You please go ahead and log into the system and select this session on Policy and Compass, and then you can submit your questions, which we'll be delighted to take. Okay, so we talked about coverage a little bit this morning during the plenary session, and this breakout is designed to give you a little bit more information on how we're tackling issues of coverage and access with the Foundation. So this is our mission statement around the coverage and access team, that we are tenacious advocates for people with cystic fibrosis, that we know how complex this health insurance system is for you all, people living with cystic fibrosis, families, and certainly the care teams as well. We know you guys spend an awful lot of time on the care teams navigating insurance. We get it because we're right there in the trenches with you. And our mission really divides into two parts: to make sure that we're promoting innovative coverage policies, that we're really moving the ball forward faster, and we're being proactive on how we pay for high-quality specialty care, and also that we're being proactive in really breaking down barriers. So we're excited to talk to you guys about just how we do that in some more granular detail. So I'm going to hit the policy section first, and then I'm going to turn it over to my esteemed panel to really guide you through some of the great work that Compass does. So I think about the way the Foundation tackles coverage and access really from two prongs. We tackle it from a systemic way through policies. And then we tackle it in a one-on-one individual casework by casework, issue by issue way in Compass. And some of the things that happen on that individual level are just fantastic. So our target audiences when it comes to the policy and sort of the systemic issues are certainly policymakers, and obviously we're spending an awful lot of time as a community thinking and talking about that on a very high level with the healthcare reform debate underway in Congress and with the administration. But we also talked about policies that help people with cystic fibrosis through state legislatures, and then also really importantly at the regulatory level. So what does that look like? That looks like the Centers for Medicare and Medicaid at the federal level, CMS, the largest payer in the United States. It looks like Medicaid regulators in states. It looks like health insurers, private health insurers, Aetna, United Healthcare, Blue Cross Blue Shield, Cigna, individual plans. We'll dive into the people who are making decisions and really help them understand cystic fibrosis so they can get better coverage criteria for CF. And then Compass, I don't want to steal their thunder, but as I said, it's amazing one-on-one casework with people with CF and care teams. So policy, what do we do and how do we do it? So we advocate, as I said at this morning's session, if you were able to listen to that, we advocate for coverage policies that also sort of ground in that affordable, accessible, available tenets that we talked about this morning from the plenary stage. But we really want to make sure that each individual policy for cystic fibrosis therapies is appropriate. And what do I mean by that? Really, one of the core things that guides us is, does it look like what the guidelines suggest? Does a CF policy or a health insurance policy and how they're tackling individual criteria for pulmozyme, TOBI, Caistin, hypertonic saline, enzymes, is that what is recommended by the guidelines? And when it's not, we're going to let them know about it, and we're going to explain to them really why that evidence-based guideline came out, what it was based on, the science it was based on, the data that was gathered. The registry is a really important tool here. And what we do is really work one-on-one with these payers. Again, be they a public payer like a Medicaid, a state Medicaid, or a private payer. We do this through a lot of correspondence, phone calls, in-person meetings, letters, and it's really sort of depends on the issue. And for some of these payers, we have long-standing conversations. Some of them are more open to our conversations than others. Some of the payers are very proactive in reaching out to the Cystic Fibrosis Foundation because they know that we're engaged on this. They want to hear our opinion. Others, we have to bang the door a little bit louder. And here we're really working hand in hand with our partners like Bruce Marshall on the clinical affairs team to really make sure that we're educating the people who are making decisions on what a cystic fibrosis coverage plan or policy looks like using expert advice. And what I think about here is the foundation is really putting on its medical specialty society hat. Right? The really cool thing about the CF Foundation is that we are fundamentally, first and foremost, a patient advocacy organization, but we wear a lot of other hats too. We're a funder of research. Everybody knows that story. We're also the Medical Specialty Society, right? We accredit the care centers. We set up the guidelines that govern CF care. And so we can use that role to go back in and advocate as the experts in this area to say, did you get that right? Is that how you really should be covering inhaled antibiotics, or do you need to make a change? And I think when we, a lot of other folks are in the mix and having this conversation too in this space, particularly when you think about a prescription drug. The manufacturer of the drug is often having those conversations with payers as well. What makes us unique is our job as the advocacy organization, as the voice of the community, is to tell the full perspective on what cystic fibrosis care looks like and how each particular therapy may fit into that big picture story. So certainly manufacturers of therapeutics are having conversations about their particular drug or therapy. Our job is to tell the whole picture and how each piece fits in. And I think that really gives us a different seat at the table and an ability to tell a longer story. So I'm not going to spend much time on this, but basically I think it really varies on how we get involved and when. A lot of the issues that we do get involved in with the policy of coverage often come from the community, either through a phone call from a care center, a phone call from an individual patient or family, and certainly through Compass, where we're able to spot trends and say, is this a one-off problem that has to do with this particular person's individual plan? Or is this a systemic thing? Is this Medicaid agency have a bad policy for a particular therapy that we need to get engaged? And again, depending on how the issue arises, we'll craft a strategy and figure out what tools we have in our arsenal to really combat a problem and try to make it better and improve it so that the coverage really looks like what CF care needs to look like. And then we'll go to bat and engage. Some of the issues that we're facing right now that are sort of on the docket right now. Orkambi coverage does still raise high on our issues. We have been engaged with payers on Orkambi and explaining particularly how it's different than Kalydeco. Obviously, if you've been paying attention to the corrector story, you know that Kalydeco and Orkambi do look different in their outcomes, particularly in the clinical trials. And that's taken a lot of explanation about why overall the approach of having a cystic fibrosis CFTR corrector is important, how that would be incorporated into the clinic. And we've seen some creative coverage criteria for these drugs, so we monitor that closely and engage on that. We also are watching very closely the Affordable Care Act marketplace. Obviously, that's been something that's been in fluctuation in some states, and we really have weighed in with particular plans. Our job really there is to make sure the care centers are covered, to make sure they're in network, or that they're easy exceptions when they're not. And that's something that's really important to us and will remain so. And I think that sort of builds into network adequacy. What that really means is a cystic fibrosis care center in network, or if it's not in the network of a plan, do you have a ready exemption and an easy way to make sure that somebody with CF gets their care at an accredited care center? So that's just a snapshot. I showed this slide this morning as well. This slide is busy because we are busy in the areas of coverage and access. The different colors just represent different ways that we engage with payers. This is primarily a Medicaid payment slide that reflects, but it basically just means that we have engaged on a lot of different levels, all the way from budgeting for Medicaid down to very detailed things like pharmaceutical and therapeutics drug utilization review boards, and one-on-one conversations with the clinicians who make those coverage decisions. So really, I think the point that we want to get across here is there are a lot of different ways that we do engage around coverage and access. Some of them are much more public than others. Some of them are letters and correspondence and phone calls with folks way in the weeds of regulation. But I'm proud to say that we've had a lot of great results from several years of having these relationships with payers and a lot of good dialogue and hopefully an improved understanding of what CF coverage really needs to be. So we're going to skip over, and I'm going to introduce our amazing Compass panel and pass it to Ozzy. Thank you.
Thanks so much, Mary. So I want to start off first by asking how many of you before this VLC had heard of Compass before? Wow, okay, that's fantastic. I was going to ask if any of you remembered that for years now, the CF Foundation has been offering patient access services to people with CF and their families and their care team. But our scope in the past had been really limited. And frankly, because of our knowledge base and expertise, and because of the amazing leadership of Mary Dwight and Ann Willis, we have taken patient access services to a whole other level. And in late 2015, we decided to scrap what we used to call our patient access services, the name, and start all over again with a new name and a new look called CF Foundation Compass. And what I'd like to do is to show you, and I know you've seen the pictures before, but I do want to show you because it's so important, the face of Compass. Those are the faces of the Compass case managers that would assist you with all sorts of issues beyond just coverage and reimbursement, which is what we used to focus on in the past, but about all kinds of other everyday life concerns that people with CF might be facing. And what I'd like to do, I'm going to go into detail in a little bit about some of the services that we provide, and talk to you about our first year under the name CF Foundation Compass. We had an amazing year. We handled over 5,000 cases, as Mary mentioned to you before. And just to give you a picture of what that means, in prior years, we handled maybe about 2,000, 2,200, so our volume grew over 100%. And what that means, of course, then, is capacity and being able to assist everybody who needs help. But it showed us that there is an absolute need for assistance. How many of you here like calling insurance companies? I'm just curious. No one, no takers? Well, believe it or not, our team of case managers love to do that on a daily basis. They would like to take that burden off of your shoulders. We know how busy you are. We'd like to take that off of your shoulders, and we'll make the calls for you. So when it comes to insurance or financial issues, and I'll talk about that in a little bit of detail, questions about legal concerns, and many, many other things, you know that you can turn to Compass. Now, in our first year, we learned something really valuable. Here are the top 10 concerns from our community. And you'll see that the number one concern is financial assistance. And that's financial assistance that goes towards direct care and medications for caring for CF. And, of course, followed by insurance issues, as we all know. The insurance landscape is ever-changing, and with it come all kinds of complex issues, just as Mary mentioned. Who can call Compass? It's not limited just to people with CF. It is available to their families, spouses, parents, extended family, and even the care team. When there are concerns or questions that you have, you know that you can turn to Compass. And Compass is free. It's confidential. We will not share your information with others. And you can call, no income limits to call us. We will help anybody, whether, whatever, regardless of your income or insurance status. So what do we mean when we talk about insurance, help with insurance? We, every day, help people understand the basics of their insurance coverage, all the way to really complex coverage, like negative coverage decisions. We help with appeals. We help overturn some coverage decisions. We have even gotten some payers to make product exceptions by really making a case for why they need to have the medication available to them. With the help of the wonderful care team, we put together the necessary documentation to show medical necessity, and we get the products covered. Financial assistance, and I want to really focus on this one a little bit. Compass can help connect you with all kinds of programs that are out there. We learned that many people don't realize how many different programs there are, or they just don't have the time to dedicate to researching and finding out what's available. That's what we're there for. We have been collecting this information for years. And by programs, I mean everything from manufacturer copay assistance programs to small local programs that are available just for you in your state or in your county. We have been collecting that information. Our wonderful patient advocates are knowledgeable about regions. They know what is available for you, and they look at your specific need, and they can help you connect. But what's even more important, and I want to really stress this, something that most people don't realize, when you learn about one program, one copay program, or a foundation, you don't want to just go to that one. There are so many others available. Come to us and we'll help you coordinate all of these so that you can maximize all the benefits that are available to you. There are programs that have caps, and you can very easily, as you know, with the expense of medications that treat CF, you can blow through that cap very quickly. If you call us, we can help you coordinate, and we can help you figure out what order to go through these programs and take advantage of them. I highly recommend that you call us and let us work that through with you. When you have questions about legal rights with CF, you can come to Compass, and we will connect you with legal experts who are specialized in these areas, and it is not limited to insurance, employment issues, education, and government benefits. You can call us for any concern that you have, and we will connect you with the right legal expert. And then there's this other category, and I will give a prize to anyone here who can help us rename it. We just can't come up with a more clever name. We've been calling it Other for a while, but we can help with so much more. And I'm going to use a really strange one-off request that we had from a family whose house was sprayed by a skunk. And, of course, with CF, with breathing, there are issues. Having the smell of a skunk is really, really not healthy. They called us, and I can't come up with the technical name of the remediation, but we helped them de-skunk their house. But really, anything. I wish I could say that we can solve every problem, but what I can promise you is that if there is a solution out there, we're going to help you find it. And now I'm going to turn it over to our wonderful ladies who've joined us today, starting with Lori, to share your firsthand experience with Compass.
Hi, everybody. Excuse my raspiness. So, I am from Chicago, and in Chicago we like to be first, even if it's bad news. And you probably hear bad news about Illinois and Chicago. And so anyway, last year we got very creative with Compass, helping us with strategy. Our healthcare exchange started collapsing in 2016. Which, yeah, that's kind of sad, but like I said, we like to be first. So halfway through the year last year, one of our major insurers went bankrupt, and we had several patients on this. And fortunately or unfortunately, I had met one of the lead case managers, Aaron Stocks. If you're watching, you know I think you're stellar. And so I called up Aaron desperate and said, I'm going to have a lot of people calling you because I don't know what to tell them either. So we decided to collaborate and save time on both ends. And so this was a very creative, I thought, collaboration with Compass. So I would get insider documentation at my institution, and I would send it to Aaron because I considered him an insider. And so we were sharing information. I was having patients call him because we had to quickly help people with a quick turnaround of losing insurance to get their new plan with very limited networks. In addition to this, the managed care situation with Medicaid in Illinois is problematic, so we don't like to share. So not many CF centers are in network with our managed Medicaid. So we have about 100 patients in our adult center at Northwestern, and I had a lot of people in some desperate shape last year for coverage. And so I have to say that through Aaron's direct contact with them or his sharing of the information with the other case managers, I think we were able to streamline the process with trying to help people get coverage, get into a network, get into a CF center, whether it was ours or another one. And it was just really problematic. And so I really appreciate how Compass saves time for the care team because this is very time consuming, as you can imagine, but also they're reassuring to us care providers who are like, what are we going to do? So that was very helpful. And just one quick way that Compass has helped too is we've had some international patients, and it's very complicated at times to help international patients get coverage in the United States or to find the right place they can go. And so Compass has really partnered with us in that realm too.
Thank you so much, Lori.
Sure.
And now I'm going to turn it over to Kat.
Okay. Yes, I'm from Montana, and I know there's at least one other Montanan out there, right, Tina? And so in Montana, being able to seek out when you move from the private sector into the marketplace, getting able to figure out what plan would work for you is slightly overwhelming, but even more overwhelming when you live in a village of 2,000 and you have to drive an hour and a half through whatever weather conditions there are, which I did 4 times trying to figure out what kind of insurance to get for Maylee, and all 4 times I actually got a different answer. And I was talking with Ozzy about it, and she was like, call Compass. And I was like, oh, novel concept, okay. And within 45 minutes, I had gone from our $1,400 monthly premium down to $300 a month, not knowing that just being able to use copay cards and other forms of assistance, we would be able to just drastically reduce our monthly output for insurance coverage. So that was one really big bonus for us for Compass. But I think more than anything, it's not just that it's a community resource. It's that it's this outward expression that the CFF is bridging the gap between the foundation and the patient community, and paving the way for us to feel like we're not just a number, we're not just patients, we're not just families, we're people, and that we're balancing so much. And so Compass really has, as Ozzy said, just a vast amount of resources, and it saves us the time that CF steals from us in the end, right? I mean, these moments where we're kind of picking up these insurance calls and all these other things that otherwise we should be out playing with the kids between treatments. We should be living life in between, I mean, it allows us to be more of a family when we have resources.
That's great. Thank you. We have a lot of good questions coming in. I'm going to tackle the first one because it's easy to answer. Who funds Compass? Compass is a program of the Cystic Fibrosis Foundation. It is funded entirely by the foundation, and we are really proud to be able to offer it to the community, and so pleased that it helps so many folks. Okay, we have a lot of granular questions around some of the services that Compass offers. So I think, Ozzy, you're going to be getting a lot of these. You ready? You want to like stretch?
Sure.
Okay, our daughter is currently on Medicaid, but due to income will be over the income limit to qualify soon. Is Compass able to help us find a new insurance plan that meets her specific needs? So maybe, Ozzy, you can tackle that, and then I think, Kat, if you want to walk us through a little bit of some of the back and forth you guys had, maybe helpful.
And the answer is absolutely call Compass. Let us talk through the situation with you. We will ask a bunch of questions and get down to very specifics of your situation, and then we can figure out together where to go. We have helped, just to give you an idea, during open enrollment period in 2016, so between October and December of last year, we helped over 300 people sign up for new insurance plans, and that was everything from marketplace, employer plans, Medicaid, even transitioning to Medicare. We helped with all of that. So I encourage anyone who is at that point, a transition or just needing to pick another plan because your health situation has changed, to give us a call and we will talk you through it.
So maybe, Kat, could you add a little bit? Because I think one thing that I find really wonderful about some of the components is when there are choices, being able to help you pick and choose, know what matters to you.
Absolutely. So when you go in and talk with, just a whatever they are, marketplace advisor or whatever, they have no idea the demands, obviously, of CF. I mean, they have this picture in their head of what CF is, but don't really understand all the medications that need to be approved. And so, you go through that whole process with them, which takes forever. And then you also, put on your doctors and your specialists, and you go through all this, and then they come out with something that doesn't financially make sense on a monthly basis. And so not understanding the copay options and all the patient assistance programs that are viable and very accessible within our community. And I think that's where Compass really excels, is just absolutely knowing all the different loopholes to help us to be able to, have the insurance that we need to have that full coverage, but also at a rate that we can actually still afford.
Thanks. So I have a question for Lori. Lori, can you talk a little bit about how a care center team collaborates with Compass and sort of some of the back and forth that folks might need to be aware of? Or when do you go to your care team? When do you go to Compass?
Well, I would say there's a couple members of my care team, that, including myself, that calls Compass. We call and ask for advice about certain things that might have to do with insurance or prescription copay assistance, or sometimes outside of the box things like, I haven't had a de-skunking situation in Chicago, but we might. So sometimes there's unusual things. I have called Compass and asked, do you know where I can get funding for a patient to get a bed? Because I had a patient who I learned did not have a bed. So I think Compass for me has helped me a lot as a clinical social worker, with just finding resources that I might not know or that are outside of our state even. So it's been helpful to me in that way. Also, I think it's been helpful to our clinic coordinator, our nurse, in that sometimes we need help with maybe prescriptions we're not as familiar with patient copay assistance, or just finding ways to help our patients save money. And as Kat is saying, give them back time, and we are trying to help them, and then Compass helps support us. So it's really a time-saving measure for, I think, everybody, and I've really appreciated that support.
Great. Here's one for Ozzy. In the other category, you list scholarships as a benefit. Can you share more about program guidelines and how much, if you were able to share, how much has been awarded to students, if you know that?
thousands. So there are so many different programs that are out there, and again, it's based on where you live, undergraduate, where your what your grades were. There are so many program criteria that have to be met, and in most, if not all cases, the person applying must have CF. There are a few programs out there that are available to families of people with CF, but they're few and far in between. All I can tell you is if you know someone who is about to graduate high school and is thinking of applying for school, contact us and let us do some digging, and we'll see what programs we can find out there that do offer scholarships. And they are out there. They do have deadlines. We just learned of one that the deadline is ending in mid-April. So, the cutoff will be missed, but we can certainly look at future ones.
Here's one for me. How do we avoid Kalydeco denials like that happened in Arkansas with Medicaid? That's a great question. So I'm not sure if those of you are aware, but actually with Kalydeco's, once it was approved in 2012, it was really taken up by payers quite quickly, with very few exceptions, and unfortunately one of them was in the great state of Arkansas with their Medicaid. I would say that's a case study, but unfortunately there are a lot of instances when a cystic fibrosis therapy is not covered the way we believe it should be covered, whether it be Kalydeco or, frankly, hypertonic saline vitamins and nutritionals. So that's when to me, I think of that as a systemic issue, right? If a payer has decided that the way they are going to cover a cystic fibrosis therapy, it's not in sync with what is recommended by the CF Foundation's accredited guidelines, then we will go to bat with that payer. Our first step is really trying to educate them. Again, I said one of to me, the important roles that the foundation plays in this landscape that is really unique from a patient advocacy organization is to tell the holistic story of cystic fibrosis care and how each particular therapy fits into that whole complex morass of all the things that you need to do to take care of cystic fibrosis. Why is this particular therapy important? Why is vitamin K important? Why is Kalydeco important? Why is hypertonic saline important? Why are all these things together important? And how should that be covered? So I think the longer we do this, the more the payers are open to our conversations, open to listening to the experts at the table, which honestly, by and large, are typically clinicians. We're usually having a conversation with a doctor who's on the decision-making side, so often bringing the doctor in on the other side, be it the center director or in some cases members of the national office's clinical team, to say, let me explain this to you. Let me walk you through the studies. Let me tell you how it really actually happens in real world. The registry has been a vital resource. Remember Dr. Marshall this morning was talking about real world experience. The registry is an illustration of that, and for us to be able to say, let us show you why we think these nutritional therapies are important in cystic fibrosis, has been able to sway minds. And frankly, I think the more people are aware of the cystic fibrosis story from a clinical perspective, the more they realize how unique and special it is. And we have had some amazing quotes back to us from payers to say, I just think of you all differently. I'm so glad you've come in to share what you have. Your data really makes a difference. And especially on some, unfortunately, medicine is not an inexact science. And we don't always know the exact right thing to do. We know a lot, but we don't always know the exact right thing to do. So in those gray area edges, the trust of the Cystic Fibrosis Foundation and how we will always be data-driven whenever possible often gets us to have a more robust conversation with the decision makers. So that's one of our charges, is to continue those dialogues, continue to build those relationships for whatever is to come down the pike with these novel therapies. And also some of the complexities of, I think a big question for all of us is, as new mechanisms come to treat cystic fibrosis, like the correctors, like Kalydeco and ivacaftor and Orkambi, what can we peel off, right? What do we not need? And that's going to have to be an ongoing discussion that the payers need to understand too, that we need to educate them about what really constitutes excellent cystic fibrosis care. All right, we have just a few more minutes and no more questions from the little iPad. So if anyone has any questions in the room, we're happy to take them. Yes.
I'm a CF mom. You may use my.
Sure.
Thanks, Ozzy. Hello.
Okay. I'm a CF mom, and I have gone to my senator's office and talked with his staff about CF and about healthcare and things that we need. And I felt like that was really effective. I didn't get to talk to the actual senator, but I did talk to his chief of staff for our Houston office. And I guess I wondered, is there somebody at the local level who's coordinating this across the country so that we as families can, keep that going, and so that we can be helpful and advocate? What would you recommend? How does that work?
So about coverage issues or about cystic fibrosis advocacy?
At the time I was advocating, it was because of the Affordable Care Act, and I wanted to talk about pre-existing condition coverage and kind of all of those protections that the ACA has afforded us. Mm-hmm. But I also just wanted to talk about, this is what our daily life is like, and this is how much money we spend on things. And I wanted them to have a face, to go with when they go vote on their healthcare bills.
Well, absolutely. I think the Cystic Fibrosis Foundation's advocacy department and advocacy programs are a great place to start there. There's a whole section on cff.org on advocacy as a way to get involved, and a particular section right now on healthcare reform with all of our policy positions on and why we take those positions on cff.org, and also a really easy way to get involved, be it a simple email that you can send directly to your elected officials. Calls really matter right now, and we'd really encourage you to make phone calls. The system actually, once you enter in your information, will prompt up a phone script and connect you right away to both your member of the House and both senators in about 15 minutes. And then hopefully, if you weren't able to make the advocacy session this morning, it will be archived on the live stream about all the different ways that you can get involved in advocacy, be it meetings at home in state districts, trips to Washington, D.C. through our 2 national advocacy events, one in the spring and one in the summer, and a lot of different ways. So advocacy is an excellent mechanism, and certainly right now healthcare is a hot topic, and it's really important that we raise our voice. Okay, I think we probably are out of time. We have 30 seconds left, so thank you all for joining us, and we really appreciate it.